I don't know. I just started just obviously getting more and more into the postpartum world. And so under the umbrella of all that I do, I started something called Angels Born Still, 2011, 2012. And just to, again, give an actual name and a resource in the community and to doctors, OBGYNs, MFMs, REs, just to help them know that I'm in the community as a resource. And I run several different support groups as well. I was running 6 different support groups and rotating them for all sorts of reasons, whether it was for infertility or fertility or secondary infertility. We're talking even surrogacy. Okay, then moving on to miscarriage. I had couples miscarriage. I have stillbirth. I have couples stillbirth. I have traumatic birth. I have pregnancy after loss groups as well. I've run retreats all over the world. Well, I shouldn't say all over the world, but certainly Australia and all over America. Become lifelong friends. So it's another way to create community within, for women who feel very isolated in certain parts of the world after they go through having a stillbirth or an infant death. And I also support women with preemies and NICU experiences. It's really important that women know that taking care of their mental health is just as important as their physical health. And just because it's invisible doesn't mean it's not important. If you had a broken arm, you'd go to the doctor and obviously have a cast put on it. If you have something wrong with your mental health, there's no shame around that. We really need to understand that that is part of what we need to do to support women so they have better attunement and they can show up for their babies and then their babies' mental health benefits. If they've had a stillbirth or a miscarriage, 50 to 70% of women go on to have a subsequent pregnancy. And that needs to be addressed. Women need psychological support in what we call pregnancy after loss. A lot of women who do have miscarriages and stillbirths really want to have that baby, right? They really, especially if it's their first, they really want it. They just want to get on it. They just